Good morning, sir. What's your name?
Kenneth Robinson.
Sir Robinson, why are you here today?
Just get some checkup from the doctors here.
Okay. And did I see that you brought your mother, right?
Yes.
What's going on with her? Is she all right?
Well, not that well because she have the sugar, the pressure, the eye, whole lot of complaint.
All right. And you want the doctors to check her out?
Sure.
What do you think about this initiative where we have a health fair in your community?
Well, it's a great one, it helps to enhance the community and to make the community much better off, you understand me, giving help.
Right.
Thanks for the opportunity that you have received.
So you greatly appreciate it?
Yeah, greatly appreciate it.
All right. Good morning, Mommy.
Good morning.
What is your name?
Hayes Robinson.
How are you feeling today?
Not feeling too bad.
Right. But you came to see the doctor to check you out.
Yes.
What do you feel about the health fair coming to your community?
Oh my, it is wonderful. It's not much all the while you have this. And therefore, it helps us to make the opportunity to be here.
Right.
Because what you will obtain and can talk here. If you go to the doctor, maybe you wait and you don't even get through.
Okay, and you're in a wheelchair, right?
Yes.
So that would not be a good thing if you go in a wheelchair and you don't get through.
Right.
Right. So you're happy that we're here?
Yes, I am. And when I heard, I said, well, I don't know if I'm coming.
Why wouldn't you come?
Why would I not come in?
Right.
So I said, well, go and check it out.
Right. And you're happy you did?
Yes, of course. Maybe you hear and get something that you never expect.
Right.
All
right. Well, thank you for being here.
Yes.
And God bless you, okay?
Yeah, right. Thank you too.
Right.
And I thank you that you are here to help. It's good. It's wonderful. And I would say, come again.
Morning.
Good morning, sir.
How are you?
Not good at all.
What is the matter?
Pain in my two legs.
Right.
Straight down to the toe, come from the waist.
So you're here to see the doctors about it?
Yes, sir.
What is your name, sir?
Cedric Robinson.
Mr. Robinson, you're happy that the doctors could come and see you instead of you going to see them, right?
Sir. I'm happy to see him because I've just been to him the other day and he gave me some treatment. I don't even finish taking those tablets as yet.
Right.
But man, this pain goes away and come back.
Right.
The doctor told me it's arthritis.
Right.
I said, well, he said, Mr. Robinson, you feel that you're better, you're not better.
Right.
It's arthritis.
Right. So you're hoping the doctors will help you today?
Yes, sir. I do hope so.
And you're happy they're here?
I'm happy. I'm glad for them.
Right.
For you all.
Right. All right. Well, we're happy to be here too, okay?
Yes, sir.
So thank you.
Yes, sir. Thanks, sir.
All right. Good morning, Mommy. How are you?
Not too bad, sir.
What is your name?
Elaine Perry, sir.
Miss Perry.
Yes, sir.
Why did you come here today?
Because I have a tooth here shaking and I want it to take out. And I have a pain in my stomach. And
You want to check that out?
Yes, sir.
Are you happy that the doctors are here today?
Yes, sir. Give him praise, sir.
All right.
Thank the Lord for them, sir.
Okay, well, we're happy to be here and thank you for coming out. I hope you get your relief today, okay?
Yes, sir. Yes, sir. I believe so, sir.
Good morning, Principal Wallace. How are you?
Good morning. I'm so good. I'm blessed.
Right. So we're here at Mangal Basic School and we are having a health fair today. Tell us about it.
Okay. I was told about the health fair by Dr. Dixon and now I have seen where it has come true.
Right.
Because I see a lot of doctors and dentists and people are coming out there really excited, especially about dental work being done.
Right.
Because it's so expensive out here. So this is a good boost for them. They are happy to live here and I am happy that such a venture could have happened at my school.
Right. Now, you have been enjoying a partnership with the Charter Foundation to restore the school and to get things going, upgrade things here. How has that been going?
As I said in previous interviews, that Jaja Foundation is the only foundation that has ever come to us and said that they are going to do something, and they have actually come true. So we have the benches there to prove, beautiful tables and desks for the children to sit around. We have the place being painted, we have the kitchen being refurbished, we have the bathroom that is being worked on, and I'm telling you, it is really a joy for me.
What sort of response have you had from the children
Oh my
since
God!
they have gotten this new?
When they came in and they saw the benches, they said, "Teacher, I got new benches. We have new benches," and they were all over them.
Right.
And now, let me tell you, what we had before was not really conducive to group work and group activities.
Right.
So you see, these tables that we have now, they really help the children to work together because they are big enough. They put them together. You do a lot of activities. I am telling you, this is wonderful for them.
Are they here now?
Yes,
So all this, so from 1 to 30,
Yes.
and this one that you answer,
Yes.
and then everybody else, just any number we give to them.
Dr. Dixon, you're joining us with Principal Wallace. How do you feel about this initiative coming to life?
Well, I'm excited. I'm obviously I'm a little apprehensive. I want to make sure everything goes well, but I'm excited and I'm optimistic that things will go well. This is something that just built. It's an initiative that was built. The first part of the initiative was to get to know the community, get to know the key players within this community, as how we saw it. And like I said, local champions is what drives the Jaja Foundation. When we go into a community, we identify the individuals in the community who are passionate for that community and who wants to see that community do well. And they volunteer their time. Okay, they don't ask for pay. They do what it takes to get it done without any kind of financial compensation. The principal, Miss Wallace, is a perfect example of that, along with Craig, who's our other local champion. And they fight tirelessly at night to make sure that this comes, to fruition. They sleep here at night. Craig slept here last night to make sure that the tents and everything were secured and that everything would go well today. And these are the kind of local champions we talk about, people who fight the fight without any kind of financial reward.
Right. So, Principal Wallace, you tell us about how you met Dr. Dixon.
Oh, and he spoke about Craig.
Right.
Craig is very
Instrumental. Yeah.
yes, in me knowing Dr. Dixon. He was the one who introduced us. He was the one who spoke to me about Dr. Dixon, and then Dr. Dixon called.
Right.
And after he called, we have been talking over the year, because it's a year and something.
Yeah, it seemed like forever, but it's only been a year. Yeah.
And we have been talking and working out to get things done.
So, good morning, Jerome. How are you?
Good morning. I am fine, thank you.
What are your thoughts on this project here that the Jaja Foundation is doing here in Mango Hall today? Community health fair for the students and the community.
The thought is always going to be a thought of Thanksgiving and well worth it and well done. And with Jaja Foundation being here today, giving back to this community, as also assisting those in need of health, it's always a good gesture, and it's always something that people will be thankful for. Not all persons is or will be able to afford the cost or the expense of good health in Jamaica. And Jaja Foundation is here doing it, I would not say free, but because of blessing this community to give good health and proper care to those in need of it. So it's a good gesture.
What is your name, sir?
Barrett.
How are you, Mr. Barrett?
Not bad.
What are your thoughts on the Jaja Foundation putting on a health fair here for the community today?
Well, it's really a good plan, Help us as poor people.
Okay.
One of the best thing ever happened.
Yes.
It's one of the best thing ever happened here. Trust
Yeah?
me. Yeah.
There's a lot of needs in the community, huh?
Yeah, man. We need more of this.
What's your name, sir?
So good. Mandison.
Mr. Mandison.
Yeah, man.
So you feel that having these sort of initiatives are very good for the community?
Oh my God, this is so good. It's so great. One of the best thing ever happened here.
Wow.
Yeah, man. In Little London.
All right,
So
well,
good.
we're happy to be here, to serve the community.
Yeah, man. Thanks. And we really appreciate of it.
All right.
Yeah, man.
some of us poor people, don't have the money to do this type of things.
Right.
Even to pull a teeth, it's most expensive. To clean your teeth, it's most expensive. Everything you're doing here is expensive. So
we don't have
we
the
are so
money.
glad for that, and the money is
Very
low.
appreciate that. We don't have the money to do it. That's why I am even here today.
Right.
Yeah, man.
All right, well,
Glad for this.
we're happy to be here and to do what we can to help. Right? Do you have any thoughts, sir?
Yes, I wish you people should come more often.
Right.
More often, because most people don't have the money to extract teeth and heal teeth and clean teeth. So we wish we should have this program more often.
Morning, Dr. Johnson.
Morning. How we doing?
Fine, how are you?
Awesome, man.
Are you guys excited about
Very
the health fair
excited.
today?
Absolutely. Getting set up, man. As you can see, all this stuff we're setting up for the people. We're expecting a big crowd today.
All right. You did a little health fair yesterday. You participated in some dentistry.
Yeah.
Yeah, what was that like yesterday?
Man, yesterday was great. We actually had a chance to see some kids and some adults. So we're expecting a larger crowd of adults today. So they shut down the whole school today to do nothing but health fair and dentistry. So it's gonna be a big day.
Have you noticed any particular pattern emerging regarding the children in terms of their dental issues?
Yes. So on the plus side, I did see some that had really nice teeth, and then some others that had, the ones that did have cavities, it wasn't like one or two, it's like they had multiple cavities. So the biggest thing is just education. Educating on how to properly take care of their teeth, and diet is the biggest thing. There's lots of juice and sugar cane and all that good stuff here in Jamaica, so it's definitely having an impact on their teeth.
Right. And what would you recommend that the parents do to ensure that they prevent against these issues?
Yeah, so biggest thing, like I said, is education. So educating them on how to properly take care of their teeth, minimizing sugar intake, whether it be candy, juice, sugar cane, whatever the sugar source is, we want to minimize it. Not take it away totally, but just minimize it. So definitely twice a day, you want to be brushing. And you want to be flossing daily as well, once a day.
Good morning, doctor.
Morning, how are you doing?
Fine, how are you?
Very well, thank you.
Are you looking forward to the health fair here today at Mango Hall?
Yes, it should be a great fair. We're looking forward to seeing a lot of kids, so it should be a good time.
Good morning.
Good morning, sir. How are you?
I'm fine, how are you?
I'm okay.
Please introduce yourself and tell us what role you're working in today.
Dr. Bradley from California.
Right.
I'm working with the dental group,
Right.
and I'm doing intake, helping with the intake.
Okay, and what are these bags that you're putting together here?
Those bags are bags that we're going to give out to the children
Right.
once they've seen a dentist.
What's in the bags?
Basically goodies for schools, like rulers and hygiene stuff like toothpaste, toothbrush, maybe some floss,
Right.
even a little face cloth, for them to use. A little booklet with information in on, taking care of your teeth.
Right. Nice.
Okay.
Well, thank you for your service. We're really happy to have you here volunteering in Jamaica for the Jagger Foundation.
Thank you, sir.
Good morning.
Good morning, how are you?
I'm fine, how are you?
Wonderful, thank you.
Please introduce yourself.
I am Nicholas Scott, a volunteer.
Right, are you from Jamaica?
I am Jamaican, born and bred.
Where in Jamaica are you from?
I'm from Seaford Town in Westmoreland.
All right, so you're volunteering your service, your time today with the Jagger Foundation. Why did you choose to make such a contribution today?
Okay, I have been affiliated with Miss Karen Shields, which is a part of your foundation, and I was introduced to the Jaja Foundation through her.
Right.
I'm off, so I'm volunteering my day.
Why do you think it's so important to give back to the community?
It is important to invest in our future. It's important to invest in our children, who is tomorrow's future. So I do believe that this is a way that we invest in them so they can become better men and women for tomorrow.
Okay, well, we are very appreciative that you're here. Thank you so much.
My pleasure.
All right.
Thanks for having me.
All right. Good morning, Dr. Jackie.
Good morning.
How are you?
Good morning. How are you? We're here setting up at the Mango Hall Basic School, one of the schools we've adopted.
Right.
And we're ready for a busy day. It's our last day here with Jaja and the island, and it's been a productive 4 days so far.
Right.
And we're here to just do good for the community. Looking
All right.
forward to the day.
So you've been doing a lot of dental work across the country.
Yes.
Since we've been here. Have you noticed any emerging trends with the children?
With the children, you know, again, even in the school systems, it seems like they're high fructose level drinks that are being served and lots of candies. And I'm not sure if it's education, but a lot of the children do have pediatric caries. We have a group that's just doing the education with them and telling them what's good to eat and what's bad to eat, how many times they should be brushing a day. And it's important that they brush. It should be the last thing before they go to bed at night. Try to do our job with education, so hopefully when we come back next year, it will be even better.
Okay, well, thank you for being here, Doctor.
Thank you.
All right.
My name is Jean Powell. I am a Jamaican. I live in Brooklyn, New York, but I also have a home here in Jamaica. I'm a nurse practitioner by trade.
Right.
I work at University Hospital in Brooklyn, SUNY downstate.
Right. So you took time off your busy schedule to come here to Jamaica to volunteer your time to the community of Mango Hall for this health fair here today, the Charter Foundation. Tell us why.
I believe in health. I believe that every individual in a society is entitled to proper health care.
Right.
And I know that resources are scarce in Jamaica, and that is one of my main focus and my main reason for taking time out to come to give back to the community.
Okay. What are your thoughts on what you're seeing so far?
It's a wonderful initiative. The foundation has done great things here in Mango Hall, and as a new active member of the foundation, we will continue to do great things, not just at Mango Hall, but I think throughout the country.
Well, you're dancing around a very key issue here. We're standing under a tent that you're responsible for getting us this tent and the other tents here, and a lot of things that are going on here. You're the person behind it. Tell us about that role that you played here.
Actually, they had no contact person down here to get this going, and I am involved with someone who owns this company called Tents and Events, Mr. Douglas Arnell, who I've known for over 30 years, actually 44 years to be exact. And it didn't take much for him to jump in and say, I will provide the tents and I'm going to give you at 50% cost.
Right.
So, you know,
that's a very key sponsorship there. What's the name of the company again?
Tents and Events in Savlamar.
So anybody down here looking for tents, they should contact your friend.
They should contact Douglas Arnold at Tents and Events at Barry James Plaza. I think we need better volunteer or better sponsorship from especially business owners in the community. They need to start giving back to the communities because these are the people that support their business. And I am hoping and praying that from Savlamar to Negril and Black River that these community people or business owners will jump in and assist in every way that they can. Right. We're not asking them to support an entire venture, but like they say in Jamaica, one cocoa full basket.
Right.
Every little bit helps. This initiative has taken a lot from the foundation to do what we're doing here. Right. Okay, building the school, putting in electricity, building the playground, putting in refrigerator, putting in stove, just so that the children here can have a decent meal instead of sugary products. It's going to be wonderful, and this should be what should be of most important to everyone involved.
All right, well, thank you so much for being here, and God bless you.
Thank you for being here yourself.
All right.
I'm Ann Ellis. I'm a registered nurse living in New York.
Ms. Ellis, thank you for being here today at Mango Hall Basic School for the Community Health Fair.
You're welcome.
All right, so tell me, why did you leave all the way in New York to come down here to Mango Hall to be a part of Mission for Change 2018 from the Charter Foundation?
Through networking with my nurse colleagues who live here on this island. And I've been here, I've visited, and I've seen the need, so I decided to assist.
Okay. What do you think about the importance of volunteerism?
It's important to give back not only to the community where you live, but the community around the world.
Okay. And what do you think about the Jaja Foundation based on what you have seen so far?
I do believe that the Jaja Foundation is doing a well-needed job.
Right.
The individuals that I've seen, the need that I've seen just for the short time that I've been here, the Jaja Foundation has really stepped up and is representing what volunteerism is all about.
Who can count from 1 to 10?
Me.
Let me hear you count. Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
All right. Who can say the ABC? You? Let's hear you go. Try.
A, B, C, D, F, G, J, K, Y, L, M, N, P.
You can say ABC?
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Q, R, S, T, W, X, Y, and Z. Now I know my ABC. Next I want.
Please join me, right? Thank you. Dr. Johnson, quick word. You've been seeing patients. Tell us how things are going so far today at the self-care here at Manga Hall Basic School.
Oh, things are going great. A lot of young people coming in with really badly infected teeth. Just happy to be able to get those teeth out for them because obviously infections cause pain, and I'm glad that we're able to help them by taking the teeth out, relieving them of the pain, and also being able to provide them with pain medicine and antibiotics as well. But I really see that the 6-year molars are just completely bombed out in these young people, and you get these teeth in your mouth when you're 6, and they've only had them in their mouth for a couple of years. So it's kind of sad to see them having to lose such an important tooth, but just happy to be here to help.
Right, so you came down from Atlanta to be a part of the Jaja Foundation Mission for Change team for 2018. Why is it so important to you to volunteer, give your time back to people you don't even know?
Yeah, so for me, I grew up in an underserved community where I only went to the dentist one time as a kid, so I was new growing up, becoming a dentist, that I always wanted to help in those communities where the need is there. And so I just feel like coming here to Jamaica, I feel like I'm at home. I'm able to help the people that were like me, that I grew up so for me, it's near and dear to my heart because I grew up poor, and to be able to help the poor, that's something I always wanted to do.
All right, thank you so much for being here. Morning, please introduce yourself.
Yes, sir. I am Sheldon White.
Mr. White, you have been very involved with the Manga Hall Basic School.
Yes, sir.
You have made some vital contribution to the school over the years.
Yes, sir.
How do you feel about this health fair that's going on here today for the children and the community?
I feel proud of it, sir.
Very happy to see it.
Yeah, I feel proud of it.
Take care, mommy.
One thing I wanted to tell the rest of our African sisters and brothers. We should try, don't waste time. Like we're sitting here now, some should be doing some meshing or some anything like little carving.
You did that carving?
Yes, sir. Self-portrait of me.
Nice, I like it.
Save time, thank you.
Nice.
I played it, you know.
Play it, man.
Oh, I would like to be the number when the saying go. You know what? A little more oil in my lamp. That's stuff for today.
Thank you very much.
Yes, you're welcome.
Respect.